Hi, I'm Dr. Snoy. This tape is to review what you need to do before and after your vasectomy, what will happen during the procedure, and to review potential risks and complications. Before you come in for your vasectomy, you need to shave your scrotum. You need to shave the front, the bottom, the back, the sides, get at least this far up around the side of your penis, and get all the hair off the shaft of your penis as well. When you come in, you need to bring a jock or tight underwear and someone to bring you home. When you come in, we'll have you lay on the table and wash your scrotum off with sterile soap. I then use some lidocaine and I numb up this area here and along the cords on both sides. This stings and burns for a few moments until it goes numb. I then make an opening in the skin here, get a hold of this tube. I then pull the tube up like this. I remove a small portion like this and put clips on it like this. I clip it back on itself like that. Afterwards, I want you to go home and take it very easy. Put an ice bag on your scrotum off and on frequently for the next day or two. Do not do any digging, lifting, chopping, running, biking, pushing, or anything like that for the next couple of days. You can make an easy thing into a horrible experience if you want to, so don't do it. Even in 2 or 3 days, when you start going back to your usual activity, be careful. That's when a lot of guys will get into trouble. You will need to bring in 2 semen specimens after the procedure. One at 6 weeks, and then 4 weeks later at the 10-week point. Only after I've seen 2 in a row that have no sperm in them at all are you okay. Do not assume you're sterile just because you had this procedure done. There is about a 5% complication rate for all the things that I'm going to mention. These include bleeding or getting a hematoma or blood clot inside the scrotum, injury to the blood supply going to or from the testicle, or perhaps an infection. There's a small chance of getting a sperm granuloma, which is an inflammatory reaction around any sperm that might leak out during or after the procedure. There's a slightly increased chance of getting epididymitis. That's an infection or an inflammation of these tubules that carry the sperm out of the testicle. We treat that with antibiotics or anti-inflammatory medications. There's also a slightly increased chance of getting a spermatocele. That's a blowout of one of these small tubules here which carry the sperm out of the testicle. I don't do anything with them unless they get large, which they usually don't. Epididymitis and spermatoceles can develop the night of the procedure or even 40 years later. It happens without vasectomies, but it is a bit more common with vasectomies. You should consider this a permanent procedure. You can get it reversed, but it's very expensive. Insurance companies don't pay for it, and it has a fairly high failure rate, so make sure this is what you want to do. There is a 2 or 3% failure rate. Occasionally, the 2 ends of the tube can get some connection between them. You won't know it. The first sign will be a pregnancy. The chances of that happening are really small, particularly if you bring in those 2 semen specimens I mentioned earlier. But it can and has happened. And if you want to bring in a specimen periodically to make sure there's no sperm, that's a fine idea. Lastly, there's been some concerns about vasectomies being related to hardening of the arteries, prostate cancer, and testicular cancer. More recent studies indicate that they are not related, but I don't think we know 100% for sure. I do recommend that once you turn 40, that you get a rectal exam and a PSA blood test every year or 2 until you're 50, and then every year after that. This is for good men's health care and to keep an eye on your prostate. Just like women do breast exams once a month, men should do testicular exams once a month. You should check your testicles and watch for any lumps or bumps or changes, and see your doctor if you have any questions or concerns. When you come in for the procedure, we'll have a chance to meet face to face. You'll have an examination and an opportunity to ask any questions that you may still have. Thank you.